Hello. Thank you for joining the MVMA for its second COVID-19 session featuring Dr. Ireland. I'm Nicole Cass, the CE Program Manager for the MVMA, and I'll be today's moderator. A few reminders before we get started. One, if you only called in via phone and did not log in online, you will not be eligible for CE credit because I'm unable to see who it is that's on the line. Two, if you have any questions, please type them in the Q&A area. I know that many of you know how to use the Q&A function, but for those who don't, a quick tutorial. If you click on your screen along the bottom, you'll see a series of circles. Look for the black circle with the dots. Click on it and you'll see Q&A option. Click on the Q&A itself and a window will appear for you to begin typing a message. All questions will be held until the end, but feel free to type them in at any time. Now I'd like to introduce Dr. Ireland. She is the senior epidemiologist in the Zoonotic Disease Unit at the Minnesota Department of Health. She coordinates human and animal surveillance for fungal infections and investigates outbreaks of enteral infections acquired from animal contact. Dr. Ireland earned her DVM from the University of Minnesota in 2004 and in 2016 earned a master's in public health with a focus on infectious disease epidemiology. She achieved board certification in preventive medicine in 2018. Before turning to public health, she practiced as a small animal medicine in the Twin Cities. Please go ahead, Dr. Ireland.
Thanks, Nicole. Thank you so much to Dr. Boyle and the MVMA for the invitation to talk with all of you today. And thank you guys for tuning in. Those of us who work in public health know that we can't do anything alone, and we really value the partnerships that we have with veterinarians across the state. You are crucial to our public health work. So the first thing that I have to let you know is that this situation is changing rapidly. So the information that I'm giving you today is accurate today, but it's possible that recommendations may change in the future. As we learn more and this pandemic grows, we are having to adjust kind of on the fly how we are responding. And these two websites, our website and the CDC, are up to date and a reliable source for kind of keeping up with changes as they happen. So I'm sure you all know the basics because there's really nothing else in the news right now. But in December 2019, cases of respiratory illness with an unknown cause began appearing in the city of Wuhan in Hubei province, China. We now know that the cause was a novel coronavirus, which is called SARS-CoV-2, and the disease has been named COVID-19. As of this morning, when I checked numbers, there's almost 500,000 cases worldwide and over 22,000 deaths globally. In the US, we're almost at 70,000 cases and 737 deaths. I pulled these numbers from the Johns Hopkins University COVID-19 page, which I'll link to later, except I had to get the deaths number from the CDC. The most important thing to know is that these are changing rapidly. In Minnesota, we reported our first confirmed case on March 6th, and as of today, the numbers that are going out at noon today, there are 346 positive cases. Our public health lab has tested over 6,000 samples. It's probably a higher number now. I just didn't have that updated yet. A second death will be reported today. Currently, there's 41 cases that have required hospitalization. 31 are still in the hospital, and many patients have recovered and no longer need to be isolated. This is an underrepresentation of the true number of cases in our state, and the same goes in many states just because of the lack of testing capabilities. So it's frustrating to not know those total numbers, but we know they are higher than this. Since veterinarians are familiar with coronaviruses, I thought it would be interesting to show this great chart from the Center for Food Security and Public Health at Iowa State University. This one shows the family Coronaviridae and the diseases that they cause in our patients. The key point for this slide is just looking at the animal species affected in the most right-hand column. We can see that most of these viruses tend to infect only one species. They really stay in their lanes. And that is very different, say, from the Flaviviridae, which are diseases like our friend West Nile virus and many others. If we look at these viruses, most of them are infecting many different animal species, as well as the ability to infect people. So my main point here is that the SARS-CoV-2 virus likely did spill over from an animal, but which species is the reservoir and what species may have been an amplifier has not yet been determined. So it could be considered a zoonotic disease, but the current transmission is really person to person. So the COVID-19 disease is spread by droplets, and those are expelled more forcefully and farther with coughs and sneezes. And so we use this 6 foot as the distance to keep apart because droplets don't carry that far. It is may be possible to spread COVID-19 by touching a surface that has the virus on it and then touching your own mouth, nose, or eyes, but this is probably not the main way that the virus is spreading. Additionally, animals aren't as effective as fomites as hard surfaces like doorknobs and phones, so we're really not too worried about animals as fomites. And then we don't expect animals to become ill and spread this virus at this time. So when people are becoming ill with COVID-19, the incubation period is about 2 to 14 days after the exposure. This is based on both data out of China, which is indicating a median of 4 days after exposure with an interquartile range of 2 to 7. But we know from SARS and MERS to previous coronavirus outbreaks that the incubation period is likely up through 14 days. The duration of illness in people varies. Those with more severe illness can take quite a long time to recover, up to 2 or more weeks. The CDC in China has published a lot of data about the spectrum of illness that they're seeing, and approximately 80% of cases have a mild illness. They either don't have pneumonia or they have a very mild pneumonia, and 19% of cases are severe. So the patients are having difficulty breathing, they're rapid respirations, low oxygen levels, and developing severe pneumonia. 5% of patients are admitted to the ICU, and the overall mortality rate is 2.3%. That's probably a little bit of an overestimate because it's counting mostly patients who were hospitalized and therefore had more severe disease. So it may not be taking into account the people with mild disease. But we are seeing higher mortality in the elderly and those with underlying health conditions. This is a little bit of preliminary data from Minnesota. So these are the symptoms that we're seeing in the cases here in our state. Cough is the most frequent symptom. It's being reported by 87% of cases, followed by fever, whether that's a measured fever or just a subjective fever. And then headache, muscle aches, and chills are also common. Sore throats reported, but not by the majority. And then there are a small percentage of cases that are actually reporting some gastrointestinal signs, diarrhea, and either nausea or vomiting. And then the last interesting thing, excuse me, is that a very small percentage of cases, both across the country and here in Minnesota, are reporting the loss of taste or smell, which is certainly kind of a novel symptom and something that is that we're just asking about because it'll be interesting to learn more about that. So the other thing that I'd like to just share with you is how COVID-19 compares to other diseases that we think about a little bit more frequently. As epidemiologists, the numbers that we like to get a sense of with how an infectious disease can spread in communities are the case fatality rate and then also the basic reproductive number. So the case fatality rate is how many people who are infected with the disease will die. And the estimated case fatality rate for COVID-19, as I said, is 2.3%, but that's based on patients with more severe illness. So it may be lower when we consider all the infected cases. The takeaway is that it appears that COVID-19 is deadlier than the seasonal influenza that we deal with every year here in the United States, but it is not as deadly as SARS or MERS or Ebola. The other number that we like to think about is R naught, or the basic reproductive number. And at its simplest, this is the number of people that each infected person will in turn infect. And if it's greater than 1, the infection will continue. And if it's less than 1, it will eventually die out. I put these basic reproductive numbers in as ranges because they can really easily vary depending on many factors. The current estimate for COVID-19 is between 1.4 and 3.9. So for each case, they will infect 1.4 to 3.9 people. As you can see on the little graph here, measles is dramatically higher, but another coronavirus, MERS, is actually much lower. So those are some of the basics that we use as a starting point for thinking about the ecology of infectious diseases and doing the complicated modeling that can predict what's happening with outbreaks and so on. So I'm sure you've all seen a version of this graph by now. This graph shows an epi curve, which is the number of cases per day over time. And it compares the curve where we take no action to prevent the spread, which is the tall dark purple part. And that's where that R naught number is higher. It's spreading more frequently. And it compares it to one where we take action to reduce the spread and lower that value. And that's the goal right now, is just to reduce the number of infections happening each day so that our healthcare system does not get as overloaded. So what actions we take to reduce the spread really depend on where we are in the outbreak. Earlier, we were in the containment phase where we were trying to isolate cases and quarantine people who were exposed. But if that doesn't work and the disease is spreading, as it is now, then we move to the community mitigation phase. And then in our future is the pandemic management stage, and that is about managing the resources while still encouraging mitigation strategies. And eventually, new cases will decline, but for this completely new disease, we might expect to see repeated pop-ups of small outbreaks as things continue. So I know that veterinarians are already doing a lot of work to help in this community mitigation phase, but these are kind of the broad strokes of what we would recommend for how veterinarians can help. We want to maintain social distancing whenever possible. We also want vets to maintain the excellent cleaning and disinfection in their facilities. We don't want people to allow their employees to work while ill. And we want vets to keep public health and state recommendations in mind when you're planning how your business will respond. And then also to be conserving resources that may be needed or requested for human health care. So we'll talk about a few more of these things in detail. So social distancing, we really would recommend that you consider what appointments are required right now. Distancing can be achieved by reducing the number of people and animals that you and your staff are interacting with. So for the appointments that you do decide you're seeing, you can get creative with the workflow at your facility. Curbside medicine is one option. I know that many clinics are already doing this. Telemedicine is another possibility for established clients with a valid VCPR when that's medically appropriate. And I think that's a lot harder for veterinarians to wrap their heads around than it is for human medicine, where there's a lot of appointments that could be transitioned that way. And this is going to be a little harder in the veterinary world. But I know that the MVMA's Facebook group, people are sharing really good ideas about what's working in their clinic. And you guys know your clients, you're going to know what could work for your clients. If you have people in your building, you could consider temporary measures to mark out 6-foot distances to be following those guidelines. It's a lot farther than you'd think. Somebody at the health department has a big long stick that she has been carrying around to demonstrate how hard it really is to stand 6 feet apart, and it feels very awkward. So, but as I said, the Facebook group has some really good ideas out there for some of the social distancing options. Another thing to think about is planning for absences. I know that zookeepers are doing this, and I've heard of some vet clinics as well, but consider splitting your staff into 2 groups who do not overlap during this pandemic. And that way, if one person from a team becomes ill, only half of your workers may require quarantine at home. And we're going to talk about what happens if somebody in your staff gets sick in a little bit. But this may not be possible for small vet clinics. You may not have the staff volume to be able to do this. But if it's possible, especially if you're reducing your caseload, it would be a really good thing to consider. Cleaning and disinfection is also obviously important. The good news is that standard disinfection products you use are effective against the virus that causes COVID-19, but we just want you to be really aware of contact time and dilution instructions. It's really easy to just spray something off and wipe it down and not think about how long that product actually has to be in contact with the surface before it's effective. The other thing that will be a little different for vet clinics is you should focus extra attention on the high touch areas, the doorknobs, phones, computers, all those places that your staff are sharing and touching frequently throughout the day. Again, we're concerned with person-to-person transmission, not zoonotic, which is a little different than how we normally think about infection prevention in a vet clinic. So what about handling animals right now? As I mentioned earlier, there's currently no evidence that animals are a significant transmission risk for this virus. We don't expect them to become ill or to spread the virus, but just to be cautious about that low risk of animals as fomites, we are recommending that staff wear gloves when they're working with animals. Latex gloves is perfect, and that they reduce contact as much as possible. So, maybe cutting down on the amount of snuggles or face-to-face time, things like that with the patients during this time frame. And then also to remember to be practicing excellent hand hygiene throughout the day and even before and after using gloves. Just using gloves doesn't mean you don't have to wash your hands. So, so now I'll kind of talk a little bit more about like kind of the COVID-19 in people and what we're doing to reduce spread among people. So one of the biggest challenges right now is managing this pandemic with the limited testing that we have currently. The priority for testing is going to human healthcare workers, hospitalized patients, and people in congregate living settings. And so we're having to treat people who develop respiratory illness that is consistent with COVID as if they have COVID, regardless of whether or not they are tested. And this is most likely going to be the case if you, your families, or your staff develop illness, just because you don't currently fall into the categories that are priority for testing. This might change as more testing becomes available, but this is where we are right now. So as we dive into this, I'll start with a little lesson in talking like an epidemiologist. So a lot of people are using these terms, but it's helpful to know exactly what they mean. Quarantine is when you are staying away from people and places because you are well, but you may have been exposed to a sick person while they were infectious. And isolation is when you're staying away from people and places because you are sick and infectious. Another additional term that we're seeing frequently is self-isolate at home. And what that means is that if you're sick and you're self-isolating at home, we recommend that you stay in rooms away from others in your household, like have your own room and bathroom if possible, and to minimize your interactions with other family members. This is going to be difficult in some scenarios, obviously, but what we've learned in countries is that the most transmission is happening within household groups. So trying to keep your distance from people who are ill at your house is ideal. The other term that everybody's using right now is social distancing, and that is reducing contact with others regardless of your illness status or their illness status. So now we'll get into questions that I'm sure you guys are having right now. So what if a client has respiratory illness? If a client informs you that they've tested positive for COVID-19 or they have respiratory illness, strongly recommend that they have a healthy person bring in the animal for them. Clients don't technically have to tell you that they've tested positive or even if they have illness, because that is private health data. But it's possible that in the current conditions, people will be willing to share that information. If it's not possible for a client to have somebody else who's healthy bring in the animal, definitely have that client stay in their car or like in a different room in the house if it's, if you're a mobile service. And then a staff member with appropriate personal protective equipment, which is eye and respiratory protection, gloves, and a gown or lab coat, could interact with that person to bring the animal into the clinic or to a place where an exam could be done. It's definitely not an ideal situation, so that's why I would really recommend a healthy person if possible. So what if one of your staff members develops a respiratory illness? This is the most important thing. You need to send them home. So I really want you to remember that the longer your staff work while ill, the higher the likelihood they are going to transmit to other staff who will then also have to go home. So it's really important that people tell you if they are having symptoms, cough, fever, body aches, chills, and send them home. And what we'd want them to do is self-isolate at home until all of the following criteria are met. We want their symptoms to be improving, which may take up to 14 days. When people have more severe illness, it's really taking them a long time to get over it. The second condition we want them to meet is that it has to be 7 days after illness onset. And then the third is that they have to be 3 days fever-free without using fever-reducing medications. So at a minimum, people would be out for 7 days, but it could be much longer if their symptoms are taking a long time to improve. What about the coworkers of somebody who's ill? So you send home one of your techs. What about the rest of your techs? Right now, the coworkers of an ill person should continue following the recommendations that we have for the entire state of Minnesota right now, which is social distancing, wash your hands often for 20 seconds, cover your cough and sneeze, don't touch your face with unwashed hands, and monitor yourself closely for symptoms. This will be different if a staff member actually tests positive for COVID, and I'll come to that in a minute. But most of you and your staff probably won't get tested right now, so it's mostly just about what to do if somebody's just ill. So again, coworkers of somebody who's ill can be at work. We just want them to follow these recommendations. So what about if you get ill? The same rules apply. You need to go home. And I know this is going to be really, really hard for many people to do. But as one of my colleagues likes to say, nobody likes a hero. And what she means is just that you are going to infect more people the longer you stay at work if you're sick. So it's really crucial that people head home when they're not feeling well. And again, self-isolate yourself at home until your symptoms are improving. It's been 7 days after your illness onset and 3 days fever-free without medications. So what about your family? What if one of your family members gets ill with a respiratory illness? Because transmission is a lot easier within a household, MDH is recommending that household contacts of people with respiratory illness, whether it's a confirmed COVID case or suspect, self-quarantine for 14 days. And again, that quarantine, if you're the healthy person staying at home, should ideally be away from the person who is ill, just to reduce that risk of transmission. So what if your facility has actually exhausted staff supply due to illness? Since your staff likely won't be tested, there probably won't be formal requests for quarantining exposed coworkers, but you could end up with many people sick. But human healthcare facilities are may be allowed to have their exposed staff working if they're asymptomatic and they're following certain recommendations. And if we modify those recommendations for veterinary facilities, they would include wearing a mask at all times that you're at work, avoid close contact with coworkers and clients, like maybe try to be the person answering the phone or filling prescriptions, doing lab tests, things like that, and then also to be monitoring closely for symptoms. So again, this is for people who are not ill but have been exposed to somebody who's ill. They could work with these recommendations. And then give us a call if you have specific questions about that situation. So, and then I thought I'd just cover a little bit what would happen if somebody actually tests positive. If somebody tests positive, the rule is that they should self-isolate at home until they meet those 3 criteria, which we've been abbreviating as the 7-3 better rule. 7 days after onset, 3 days fever-free, and symptoms improved. If somebody tests positive, that the case and their contacts are going to be assessed by the Minnesota Department of Health, and the case's contacts will be assigned a risk level, which determines if they need to quarantine or not and what activities they can do. So the contacts of a positive case, household and intimate contacts are likely to be asked to quarantine for 14 days after their last contact with that positive person. For coworkers and acquaintances, there's not a formal recommendation for quarantine. It would just be social distancing, monitor for symptoms, the things that all of us should be doing right now. However, veterinary and other healthcare workers often have contact at work than typical office workers, just because of, you're working together on a patient and spending so much time together each day. So it's possible that veterinary coworkers of a positive case could end up having recommendations to quarantine after contact. But again, that permission to work may be granted for a short staff if needed. So you can give us a call if you have questions about that. Again, I do think that most of your staff are probably not going to end up being tested. So it will be these true quarantine recommendations likely won't happen. So just a couple of tips on what everybody should be doing right now. Again, it's these kind of big 6 rules: social distancing, wash your hands, cover your cough and sneeze, don't touch your face with unwashed hands, monitor yourself closely for symptoms, and stay home if you're sick. And then what should everybody be doing if they do get sick? Again, we want them to stay home. We want them to be avoiding public areas, public transit, and people. Covering their cough is still really important, so is washing their hands. And we want people to seek medical care if needed. If people feel like their symptoms are something that they would manage at home without seeking care, that is perfectly appropriate right now. It's kind of up to everybody's individual discretion. If they feel they need care, they should call their clinic and ER ahead of time before going in. We also want people to clean surfaces often that are touched and to not share personal items with other people if they're sick. And then, the kind of standard recommendations for drinking plenty of fluids, resting, and taking pain and fever medications as needed. So some other things that veterinarians can think about doing. The Minnesota Medical Reserve Corps is open to veterinarians. If you're interested in learning a little bit more about it and signing up to see if any of your skills would be useful for them, the link is here on the page, so you can check out a little bit more about that. The other important message I have is that next week's webinar is Dr. Julia Wilson from the Board of Veterinary Medicine. And the preview message that she asked me to convey is that the inventory of PPE that you've been asked to supply does not include latex gloves. Since latex gloves aren't used in human healthcare, your inventory of latex gloves does not need to be reported, so you can keep them and use them. they do want you to report any inventory of nitrile gloves. And in case you missed the email or don't have the link, this is a link to the survey where you can report your inventory. So let's see, again, there's information on the CDC website, the Minnesota Department of Health website, and then I also put in a couple of other interesting things, which you may have already found, but if you're interested in the data for this pandemic, one good resource is the Johns Hopkins University Coronavirus Resource Center. It's a map of where cases are happening and how many deaths are being reported and so on. You can look at it as all total confirmed cases or active cases, and you can zoom in on individual countries, and then here in the US you can see by county. So if you hadn't seen that and you're interested, it's really a good resource. Somebody else has actually taken that same data and put it into different visuals. So the link is here, but with this website, you can actually, they've put everybody at the same time frame, so you can compare countries and see how particular countries are responding compared to others. And you can play with scales, and then you can also look at individual US states on there. So that's kind of fun to play with if you're curious. A couple other interesting things. There was a really nice article in the Washington Post about how social distancing actually really helps in this scenario. It's a good visual of why it works. So if you hadn't seen it, it's kind of fun to check out. And then last thing that I'll recommend if you're really interested in the topic in general, but maybe don't want to learn about COVID-19 specifically, this book called Spillover by David Kamen is excellent. It's one of my favorite books, and it's filled with amazing veterinarians doing really cool stuff. So it's a really good read. Let's see, a couple other things just from our communications unit. MDH is working on getting all COVID-19 materials and resources into languages other than English. So that's things that you can find on our website if that is useful to you. Let's see, so I think that's actually the end. So the last thing I just wanted to say before we get to questions is that this is going to be a very challenging situation, and all of us are going to be affected even more than we are right now. And as veterinarians, we're really skilled at dealing with people when they are scared and stressed. And so those abilities are going to be really important in the next few months. So I just want to remind everyone to be kind to each other, be patient with people, and take time to care for yourselves and your families. Thank you.
Thank you, Dr. Ireland. And I have a handful of questions here. I think you touched on a lot of them, but I think it's important that we reiterate some of them. So a question specifically about if somebody somebody as a coworker or is feeling ill or does end up being tested positive, if they can get the test, does the clinic need to shut down?
Oh, that's a really good question. And I had meant to put that in there, but there was so much information to put in. So no, especially if we do not have a positive test, there is no reason to shut down the clinic for 24 hours or any length of time. We would recommend that you do a really good cleaning, like when you close for the night or something like that. But there's no reason to shut down the clinic at this time.
Thank you. Um, uh, Interesting question. If someone needs to report that they see another practice that's performing non-essential procedures, who do they report that to?
So that's a little bit outside of the purview of the health department, but I think that would be a good question to ask probably the Board of Veterinary Medicine, as they're the ones who kind of regulate licenses and things like that. I don't have a good answer to that. You know, our take is that we are trusting veterinarians to make good public health decisions during this time frame because they are public health practitioners, and so I would hope that people see the best in their colleagues as well.
Thank you. I had a feeling that might be out of your scope, but I'm just answering
Yeah,
what comes into me or asking
yeah,
what comes into me.
I understand.
Yeah. So you answered this question, but just to reiterate, as you indicated, people do not need to report their inventory of latex gloves, so they can still continue to use them, correct?
Yes, absolutely. Human healthcare doesn't use latex gloves anymore just due to allergy issues. So veterinary clinics can keep their latex gloves. They don't have to report them, and they can use them when it's correct to use them.
Great. Continuing on that topic of gloves, do you know or personally have an opinion if there's a benefit to staff using disposable gloves when they're going out to kind of the curbside, going out to an owner's vehicle to bring the animal inside the clinic? Should they be using disposable gloves under any circumstances?
Well, if we extend kind of our recommendation to be wearing gloves when you're handling animals to, kind of getting the animal out of the car and so on, I do think you might as well just put on the gloves before you head out there and get the animal, because you're likely to be either contacting the animal itself or its leash or carrier or something like that. So I think it would be wise to just extend to that time frame. Um, Alternatively, you can go out without gloves, come in, pass off the animal to somebody who is wearing gloves because they're going to do the exam or whatever is needed, and then go wash your hands right away. I think that would be perfectly appropriate as well.
Great. Continuing on the topic of gloves, we've talked about latex gloves, but with regards to non-latex gloves, should they be using those at all in the clinics?
Well,
So,
I my understanding is that those would fall under the category of PPE that we should try to be conserving. Um, I have to say I don't know the intricate details of that as well as Dr. Wilson will. So perhaps it's something that could be asked specifically of her, either between now and next week or then. But I would say if you are working in a vet clinic and you're seeing a patient that is ill and needs to be seen right away, and you're a person with latex allergies and you need to use nitrile gloves, I think that is appropriate.
awesome. This question actually is for me and asking if the slides will be available and posted. We will make them as available as soon as we can. Dr. Ireland and I were talking earlier today, and today is one of those days for both her and I that anything that could go wrong has gone wrong. So I cannot download her presentation to my desktop, but we will get you a copy of the slides eventually, hopefully later on today as a PDF. Is there any truth to the rumor that who have been taking ibuprofen seem to be getting ill more than those taking acetaminophen?
Oh,
You can
yeah,
answer that.
that's an interesting thing. So I've been following that, but just kind of peripherally. There's actually so much happening with this pandemic that it's hard to keep track of all of the information out there, especially when, like, because I've been working on the healthcare worker monitoring team. So we're talking to healthcare workers to assess if they can go back to work or not, and so on. So my understanding on the ibuprofen thing is that there were some people who kind of started um, this rumor. It was something that was maybe seen in France, and my understanding is that right now there is no good science to say that ibuprofen shouldn't be used. But if you have both of them in front of you and you'd like to use acetaminophen instead, that's just fine.
Great. A question. The governor noted yesterday that we're not really in the place to flatten the curve anymore. Are you able to speak to that comment at all?
Well, I actually did not get a chance to watch the governor's entire press conference. I heard it was really, really good and very educational. I did pick out a couple of pieces of information from it, and so it looks like what he was saying is, yes, we may not be able to flatten that curve as much as we would like to. And the goal now is to kind of push it out and extend it as far away from now as possible so that we have time to to build out hospital capacity, get ventilators from wherever we can, increase testing, and get as much PPE in stock as possible. So that's my impression. But I have to say, if you watched the whole webinar, you saw a little bit more of it than I've been able to so far.
Yeah, I had the same issue where I kept getting interrupted trying to watch him. Work kind of gets in the way of that, doesn't it? So just to reiterate, because some people are confused, they do not need to close if someone on staff tests positive.
That is correct. There's no recommendation that I know of any facilities to close when there is a positive test. I think it would be wise to do a good cleaning and disinfection of your facility, but that would be using the standard protocols that you have. The standard disinfection materials that you use are effective against this. And so, if you can clean all those high touch areas and so on, you do not need to close.
Thanks for repeating that. Has there been any further information on whether or not a person can be reinfected once recovered?
Oh, I have to say, my instinct is that we expect people to have immunity and not be able to be reinfected, at least in the short term. But I really don't know any more than what my kind of like general sense is. So I shouldn't really say more than that. But I don't think that will be a problem in the short term.
Thank you. Okay, I'm just reading these as they come in, so
I
you might
appreciate it.
hear a
That's fine.
repeat. This is regarding PPEs again. If the client is healthy and not showing signs or symptoms, what is the recommendations for taking the pet from them during curbside? So I think we kind of answered that, but go ahead and repeat that.
Oh, sure. Yeah. If your client is healthy and so on, then the recommendations are kind of what every person out in the world should be doing right now, trying to maintain that 6 foot distance. So hopefully the pet's in the back, and you can just talk with them through the car window and then grab the pet. It's kind of a brief interaction. I think that's completely normal, and you wouldn't have to wear a mask for anything of those kind of situations. It would just be keeping your distance while chatting with them briefly.
Great. Continuing on talking about curbside services,
Sure.
this clinic is doing curbside services, and all their employees are wearing masks all day while they're there, wearing
Okay.
gloves, washing their hands, sanitizing surfaces regularly. Do you think that is sufficient?
I think it sounds like they're doing a really good job. Um, I think they can. The only thing I would think about is just to be considering what procedures they're seeing, what patients they're seeing, what procedures they're doing, and kind of encourage them to be maintaining that social distance by not having tons of people coming to the clinic right now. But it sounds like they're doing a really good job.
Great. I think this last question that I'm seeing here, oh, maybe there's more, take that back, but this next one might be best asked to Dr. Wilson, but just in case you feel comfortable in answering this, how do you feel about still doing heartworm tests and vaccinations, etc.? We think these are medically necessary, are still within the scope of non-elective procedures.
Well, so I agree. This is probably a better question for Dr. Wilson. It's not actually under the health department's purview to determine what types of patients and types of appointments a veterinarian can see. And there are regulatory guidelines from the Board of Vet Med and the Board of Animal Health regarding postponing elective procedures that require the use of PPE. But from the health department's perspective, we would encourage you to be keeping public health in mind right now when you're planning your operations. And the fewer people who are out and about interacting right now, the better.
Great, thank you. Okay, are there recommendations regarding self-quarantine versus immediate return to work for staff that have returned from international travel to a level 2 country recently? Does this differ from those who have traveled domestically?
I think that currently because there is so much community transmission within the United States now, that domestic travel may not be much different than international travel, especially to I think we were concerned for a while about China and Italy and a few of the really big hotspots, but now this virus is spreading in the community across the globe and here in the U.S. So if there was reason to suspect that a staff member really knew that they had exposure to a COVID case while they were traveling, then that would potentially be a reason for them to self-quarantine at home. However, if they've just been traveling in the US, they may not know what their exposure. They may have been exposed, they may not have been. And so I think that they could work. They just need to be really conscious of their symptoms and be heading home if they feel any sign of respiratory illness or a fever.
Awesome. I think I just have one last question here. Please remember, go ahead and type in your questions and I'll read them to Dr. Ireland. This last question I have, is there any evidence that you know of that the virus is becoming more virulent as the outbreak progresses?
Oh, that is a really fascinating question, and I can't answer it at all. I have no idea. I'm so sorry.
Yeah, that's, I think we're all in this together learning. So,
Yes.
hats off to everyone. Like you said, I think it's very important. People are patient with one another and they take care of themselves personally. As veterinarians, you have such big hearts and always want to give, but also remember to give to yourself. I think that's really key, and we need to remember that. Um, those are all the questions I currently have. So I want to thank everybody for joining us today. As soon as possible, we will get this recording posted to the MVMA YouTube site, and I will also make available the PowerPoints as a PDF. I will email those to each of you that were online, but we will also post them online. So thank you very much for your time. And Dr. Ireland, thank you very much for your time and energy. I know you've spent a lot of time anticipating our attendees' questions and preparing for the session. So we greatly appreciate it.
Oh, you're very welcome. Thanks for the opportunity to be here, and keep up the good work, you guys.
Thank you, everybody. Stay healthy.